While cancer patients are fighting for their lives, they are also in a battle with their insurance over a procedure that can help them avoid hair loss. Now, one cancer survivor is making that battle her next mission.
Casey Montoya has the story live from Beverly Hills. Casey.
Well, a cancer diagnosis is hard enough. For patients who undergo chemotherapy, the reality of losing their hair can be devastating. Now, there is a treatment out there to prevent hair loss, but for those who want it right now, they'll have to pay thousands of dollars.
And I didn't want the whole world to know that I had cancer.
Nina Giovannitti was diagnosed with breast cancer 9 years ago. After radiation and a lumpectomy, she was cancer-free until 6 months ago when she found out the cancer was back. Her doctors wanted to aggressively attack it with chemotherapy, meaning total hair loss was likely.
I knew that keeping my hair was a huge part of my identity. Not only me personally, because I really, love my hair, but also because of society, because of the way you're looked at, the way you're treated.
Nina's doctor said she knew a way to prevent hair loss by using a technique known as scalp cooling. The Beverly Hills Cancer Center offers patients the option of using DIGNICAP, an FDA-cleared cooling machine attached to a cap to ensure a constant temperature.
Yes, your head is very cold. You are very, very cold. It's 30 degrees. Your head is 30 degrees for hours.
By cooling the scalp, hair follicles absorb fewer chemotherapy agents, significantly reducing hair loss. In FDA trials, more than 66% of breast cancer patients kept at least half of their hair. The machines are now available in hundreds of cancer treatment centers across the country, but patients are paying out of pocket.
The biggest obstacle that we face today is that insurance, for the most part, does not cover this. And so that leaves the patient in a situation where only people who have money can afford to try to save their hair.
Trisha Strong works for Dignitana, the company that makes the DIGNICAP machine. She says hair loss isn't just a concern for women.
One gentleman I helped was an accountant, and he said to me that if his clients knew that he had cancer, they wouldn't have him do their taxes, knowing he might not be around this time next year.
Trisha had breast cancer 8 years ago, so she knows exactly what these patients are going through.
When I told them that Mummy was going to go bald, my 6-year-old daughter started to cry.
I just want it for every woman going through this. Women have young babies that don't have to live knowing mommy is sick. You feel triumphant when you go through these things and then you don't lose your hair and the whole world doesn't look at you like you're a sick person.
Most patients will spend anywhere between $1,400 and $2,800 on the treatment. And there is an organization called hairtostay.org that can help people who can't afford it pay for part of the cost. We'll get that information on our website. Meantime, Trisha, Nina, and oncologists across the country, they're just hoping that insurance companies will reconsider and start covering this treatment. We'll get more information about the DIGNICAP on our website, ktla.com. In Beverly Hills, Casey Montoya, KTLA 5 News.